In Washington, ousted vaccine official Rick Bright taking center stage, testifying before the House Health Subcommittee, warning the government's current response to the coronavirus could lead to even deadlier months ahead.
We are facing a highly transmissible and deadly virus, which not only claims lives, but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear, stemming from a lack of a coordinated response and a dearth of accurate, clear communication about the path forward. I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. There is no master coordinated plan on how to respond to this outbreak. We don't have a strategy or plan in place that identifies each of those critical components, and we don't have a designated agency that is sourcing those critical components and coming up with a strategy to make sure that we have those supplies when we need them.
CNBC contributor Dr. Scott Gottlieb with us once again. He is the former head of the FDA, of course. Dr. Gottlieb, welcome back. The explosive testimony from Dr. Bright is where we begin tonight. What was your biggest takeaway today?
Well, look, I think Rick's right insofar as we face challenges ahead with this pathogen. It's not going away. This is likely to become endemic. I think the tools we're going to have in the fall are very different in terms of dealing with this. We're going to know how to contain outbreaks in the fall, hopefully. We'll have much better testing in place, certainly. We'll have one or more drugs available to us. Eventually, we'll have a vaccine probably towards later in the fall that we'll be able to use. But this is going to circulate. And as this collides with flu season, we're likely to face challenges trying to differentiate coronavirus from flu. And this is more contagious than the flu. So if this is left unchecked, which it won't be, but if it's left unchecked, we could face another epidemic heading into the fall. Now, I think we're going to be in a much better shape to try to grapple with that and prevent it. But those are the risks.
Do we need a more master and coordinated plan, as Dr. Bright suggested today? Up till now, most of the critical decision-making, Dr. Gottlieb, has been left, as we know, to the states. Do we need a more master coordinated plan from the federal government?
Well, look, I think at this point the states have done a good job, and I think it's likely to remain a state-led effort. And I think the states are in a much better position going into the fall to know what they need. What we're likely to see in the fall is rolling outbreaks. I don't think that we're going to have another national epidemic. I hope not. I think we're in a position to try to contain spread. But we're likely to see rolling outbreaks where cities become epidemic or states have large outbreaks. And then it becomes incumbent upon local officials to implement measures to try to control those outbreaks. And so it's not necessarily a national response. It's going to be a state-by-state response. My one concern is that no state wants to go first. And so if you're a city that has an outbreak, do you want to be the city that shuts down your airport or your economy to try to contain spread within your city to create safety for the nation as a whole? And we saw with Seattle was very reluctant to take those measures when they should have. San Francisco was really the first city to implement those tough measures. And so hopefully by the fall, governors and mayors will be in a position to take more aggressive action earlier to try to contain spread if they're the ones that have that outbreak.
We're finally getting the CDC reopening guidelines. We've been waiting for those, Dr. Gottlieb, to deal with schools and workplaces, camps, childcare, mass transit, bars and restaurants. How strictly should states be following those?
Well, they're greatly scaled back in terms of what we were expecting and what the draft documents said that were leaked, unfortunately, to the Washington Post. But we got to look at those drafts because the reporters got a hold of them. And what was essentially released were some of the figures, if you will, in those documents, some of the flow charts. And so it's not very specific guidance as to businesses. And I've been talking to a lot of business leaders who are now developing their own guidelines on their return to work, what they plan to do in the workplace. And what they're generating is far more specific, far more granular, more detailed, and frankly more aggressive than what's outlined in those flowcharts that CDC put out tonight. It's not clear if this represents the totality of what CDC is going to put out, but if it does, this is pretty much top-line guidance. What the businesses are going to do is going to go well beyond this.
You use the words greatly scaled back. Does that put more people at risk, Dr. Gottlieb?
Well, it's not as helpful as it could be. I mean, I think what you want from public health officials is more detailed guidance that provides more granularity, more specificity to businesses. Businesses now need to make decisions about how to implement hygiene in the workplace, how to implement social distancing, how to create a staggered workforce so that you're not bringing people together in groups, how to implement testing in the work site if you want to, or make it available. The guidances that were put out tonight, really the flow charts that were put out tonight, all make those recommendations. They say businesses should engage these activities, but they don't provide a lot of specificity on how to do that. Now, they link back to information that's already on the CDC website, so that's a little bit more granular, but it's not specific to the workplace. And so businesses now need to go beyond these flow charts. These flow charts are sort of top line. These are the things you should be thinking about. Now businesses need to implement more detailed plans on how to achieve these goals.
Sounds like business is going to be left to itself, much like the states were, to try and figure this out on their own, including how to deal with sending children back to school, which New York's Governor Cuomo today said he's unsure whether schools will be able to open in September. Do you think they will?
I think it's too early to tell. Look, it's going to depend on what July and August look like. And if we head into July and August, and the infection rate does come down, there's a seasonal effect here. We believe there will be a seasonal effect. We don't know how powerful it will be. But if the infection rate does come down heading into July and August, and we're coming off of August where there's not a lot of background infection, I think there's going to be an attempt to reopen schools in the fall. Now, schools may take certain measures to try to reduce the risk. They may stagger classes. They may have students work from home 1 or 2 days a week. They're going to try to create physical separation. They may try to expand their campus. So there's things schools are going to do. But I think they'll attempt to reopen schools, and then we'll have to see how this progresses. If we have outbreaks around the country in certain regions, in certain cities, in certain states, I think you're going to see rolling school closures. Hopefully we don't get to the point where there's a national epidemic again and you see simultaneous closures across the whole country. But I think we're likely to see rolling closures in different parts of the country as you have local infection in a city or a state.
We're seeing China, South Korea, Hong Kong, all facing new clusters tonight as they reopen even more. Is that a preview, Dr. Gottlieb, of what may happen here as we open up more states?
We're going to have, as we reopen now, we're going to have more infection. Now, if you look at the data is actually encouraging. Hospitalizations are coming down. Cases are coming down even as we're testing more. The positivity rate's coming down. So the national trend actually looks encouraging right now. But if you follow the states that are reopening, I would expect cases are going to go up and hospitalizations will go up. That's what we expected all along. So that shouldn't surprise us. You don't want them to go up a lot. You want to continue to monitor that. And that's why we want to reopen slowly so you can implement mitigation steps to prevent more outbreaks. But heading into the fall, we're going to have cases. We're going to have spread of this virus. It's not going away. This is a coronavirus. It's highly contagious. It's more contagious than the flu. This is going to be with us. It's going to be with us until we get a vaccine. Frankly, it's going to be with us until after we get a vaccine. It's going to become probably an endemic virus that circulates each year. Now, over time, it will become far less fearsome. We'll have drugs that treat it. We'll have immunity to it. Many of us will have been exposed. We'll have a vaccine. So it's going to become something that we can deal with much more effectively. But this is going to probably become a virus that circulates around the globe on an annual basis.